1 in 4 women will have pain with intercourse. It's called dyspareunia. Dys meaning bad, pareunia meaning intercourse. And it can be either deep or superficial. In today's video, we're going to go through 7 reasons why you might have superficial dyspareunia. And you may have more than one of these reasons. So have a look at them, and then when you go back to your healthcare provider, you can have a more informed discussion with them. Reason number 1, you may have scar tissue. This can happen during childbirth or with some surgeries. You can actually get what's called a skin bridge, which is a piece of skin inside the vagina that when you have penetration, it gets irritated. That little bit of skin flap has quite a few nerve endings, and that can get quite sore when you're having intercourse. Also, when you have a baby, sometimes we have tears. They can be grade 1, 2, 3, 4, 4 being the worst. And with that, you have both muscle and skin tears. And when this heals back, sometimes the sutures can, or the stitches, can rupture, and this can create a lot of sensitivity at that area as well. So, like I said, scar tissue and how the skin heals itself can create extra sensitive areas that need to be addressed. Reason number 2, which is not very common, is if you have an intact hymen. The hymen is a thin piece of tissue that goes around the vaginal opening, and over time it thins, stretches, and tears. So some people, if the hymen is quite thick, it becomes a barrier to penetrative sex and can become quite uncomfortable. But again, it's not a very common cause of pain with intercourse. And if it is intact, then you'll need to go to your healthcare provider. Usually they'll have to do an incision or do an excision of the hymen. Reason number 3, this is called vaginismus. This is when the muscles of the pelvic floor become contracted and can prevent you from having intercourse. You can even get very tight on the inside thigh muscles. I call it like the gates are closed. So it prevents you from intercourse, or if you do have intercourse, it feels very, very tight and can be very painful. It's such a difficult contraction to control, unlike, say, a biceps contraction. It is part of a muscle guarding system. And even though you try and breathe or try and soften the pelvic floor, it may take work with a pelvic floor therapist to actually go in and do releases into the pelvic floor. And we'll talk about other strategies in a different video. But this reason is actually quite common, and it may be one of the reasons why you're having penetrative pain when you have intercourse. Reason number 4 is called Bartholinitis. Big name for 2 very small glands that sit on either side of the vagina. They're called Bartholin's glands. And when they become inflamed, when you have penetrative sex, they can get rubbed and irritated and become quite sore. When you have this type of pain, when you start to have intercourse, it's not too bad, but the repetition actually makes it more painful. So it's one of the ones that becomes more and more painful as you go and can ache quite a bit afterwards as well. Reason number 5 is called Vulvadynia. It's where the area of the vulva, so from the clitoris to the anus, becomes hypersensitive to touch. This can be aggravated by wearing jeans or tight clothing, by wiping, by riding a bike. So the actual area becomes very sensitive to touch. This is when we have to start using cognitive behavioral techniques. The physiotherapist can do desensitizing techniques. Sometimes medication is required as well. Okay, we're getting there. Reason number 6 is called Lichen Sclerosus. This is a skin disorder where the skin of usually around the vagina, towards the perineum, around the anus, becomes thin, itchy, and painful, and can have white patches on it. It is usually treated by a steroid cream, and it often happens between the ages of 40 and 60 years old. So if you find that that skin is becoming very itchy and painful, and it feels like it's thin and it feels like it's tearing when you have intercourse like this, like paper thin, then you might have lichen sclerosus. Reason number 7, it's a big one, vaginal atrophy. It's a pretty horrible sounding name for something that is so common with us. As we go through perimenopause, menopause, and beyond, our bodies do not produce as much estrogen, and so the skin of our vagina and our urethra can become thin and dry. And like some of my clients say, it feels like the Sahara Desert. And when you're having penetrative sex, it feels like it can be tearing and it becomes more and more uncomfortable. If this is the case with you, you can go back to your healthcare provider and speak with them about vaginal moisturizers or hormone therapy. I hope this video has helped you figure out why you might be having pain with intercourse, because as I said, 1 in 4 women have it at some time during their life. So although it's common, it doesn't have to be normalized. And in fact, all the reasons that we went through today can be treated. So please, when you go back to your healthcare provider, make sure you make informed decisions together so that you can have the best treatment and the care that you deserve. All the best.